And today we are going to highlight one of the most important aspect of Rasakalpa, that is Pottali Kalpana. What is Pottali? Where do we find it? How to use it? Where to use it? How long to use it? And all these kinds of questions in a small bundle of around 40-45 minutes. I am trying to highlight the six Pottalis that Sri Dhootapapeshwar Limited manufactures. So, not taking much of your time, let us go to the main topic of what is Pottali and how we can utilize this ancient science of Ayurveda in our daily practice as well as in emergency management of Ayurveda. So, as we know that Pottali is one of the in a very conspicuous way, and this Pottali is especially utilized or being mentioned for management of ashukari vikar, that is in management of acute illnesses. So as we know that there are four different types of rasakalpa: khalvi, parpati, potali, and kupipakva, where we see Uttar means from Khalvi to Parpati, from Parpati to Pottali, and from Pottali to Kupipakwa, the Agni Samskar goes on increasing. Because of the intense heat that is being given to these kalpas, their penetration into our body is far better as compared to any Vanaspati Dravya. So, are not Vanaspati Dravyas helpful? Certainly, we are not saying that. But there are a certain limitations of using Vanaspatic Dravya. So, whether you're using Kashayams, Churna, Avleha, Gritams, Stylams, affinity more towards Jatharagni. But when we see patients, we get patients who are much into advanced stage. Their disorders have already reached into the levels of Asti, Dhatu, Majja, sometimes even in the Oj. And in such cases, for better penetration, we have to depend upon Rasakalpas. And in such ways, Khalvi, then more potent would be Parpati, still more potent are Pottali Rasayan, and the most potent Rasakalpas can be seen as Kupipakva. Then, how are these Pottali prepared? And how can we use it into our clinical practice? This is what we are going to see in our today's session. So there are 82 different types of Pottali Kalpas that are mentioned in Ayurveda text. And these 82 kalpas have been divided into three major groups. One is Kapardika Pottali, second one is Kanaka Pottali, and third is Lokanath Pottali. So first one we will just have a highlight is Kapardika Pottali. So Kapardika means conch, that is kaudi. So, if you see that there are small shells that are present, and whatever the Pottali rasayan is there, it is filled into these shells, and then they are put into a Sharav Samputa, and then Agni is presented to it. Once it is entirely made into a bhasma kind of a form, it is nicely crushed. So the Pottali along with the Kaparda is nicely crushed, and then it is used as Kapardika Pottali or as a medicine. Kanaka means Dhattura. So where Dhattura is used as a major ingredient in manufacturing of Pottali, it is called as Kanaka Pottali. And the last one is Lokanath Pottali. So these are the three different types of Pottalis that have been mentioned in our Samhitas. Along with that, there are different other Pottalis like Hiranyagarbha Pottali, Pravalgarbha Pottali, Muktagarbha Pottali. Hiranyagarbha Pottali in Rasayoga Sagar itself, there are five different methods of manufacturing of Hiranyagarbha Pottali. Other than this, where do we find this Pottali reference? So we can find Hemagarbha Pottali reference in Yoga Ratnakar Adhikar. Basically, this Hemagarbha Pottali has been advised in the management of Annavaha Srotasvikar. But into our future presentation, we will see how this Pottali can be used. There is Retorodhan Pottali, which is being mentioned for Shukravah Srotas Vikar. So Retas means Shukra, Rodhan means to stop. So wherever we want to do Shukra Sthamban, in such cases there is this reference of Reto Rodhan Pottali, which is being used along with milk. So this Retorodhan Pottali has Akar Karab, Jatifal, Javitri, Ela, Kasturi, Keshar, Hingula, and it is cooked in milk. And that milk, which is the Siddh milk as we call it as, is being given to the patient for consumption. शुक्र स्तंभन के रूप में जो है वो ग्रंथकर्ताओं ने कहा है. इसके अलावा वी हैव कश्यप पोटली विच इज मेंशन्ड इन रसयोग सागर, कनक पोटली विच इज ऑल्सो मेंशन्ड इन रसयोग सागर, कपर्दिक पोटली देर इज बीन रेफरेंस ऑफ यूजिंग कैनाबिस एंड भांग. हाँ, कैनाबिस यानी कि भांग और कांजी का जो है ये लवण यंत्र के द्वारा बनाई हुई ये कपर्दिक पोटली का भी वर्णन हमें रसयोग सागर में मिलता है. We can find in Bharat Bhaishajya Ratnakar. So these potalis are nothing but one compact form of kajali, that is Parad and Gandhak. Along with that, each of the potali contains Swarna Bhasma, because of which, as we know, Swarna is a very good catalyst. And for that reason, this potali kalpana can give your any formulation a quick response to the patient. So Pottali Kalpana. So in Shri Dhootapapeshwar Limited, here we are going to highlight one of our Hemagarbha Pottali manufacturing process. So just let me go through this manufacturing process with you. So as I mentioned that every of the Pottali has Parad and Gandhak, that is Kajjali put into it. Along with that, it is having Swarna Bhasma. Here we are seeing the manufacture of Hemagarbha Pottali. So here we have set up our Dola Yantra. So in this Dola Yantra, नीचे की जगह पे हम लोग जो है वो रेत यानी कि जो समंदर की रेत होती है उसको लेते हैं. So we take sand and on that we put a vessel in which we put Shodhit Gandhak. Now, Gandhak, we do not put it directly onto a gas burner. The reason is that it can catch fire. And for this, we use this kind of a double bar, especially for maintaining the temperature of Gandhak cooked in a Gandhak mixture only. So here we have taken the Gandhak. As we know that the Gandhak boiling point is approximately 250 to 260 degrees Celsius. So the temperature is maintained by keeping a thermometer into this molten Gandhak. Here we are preparing the Kajjali. So this is Hemagarbha Pottali that we are manufacturing. So we have taken one part Parad, one part Gandhak, one part Suvarna and one part of Tamra. And along with that, we are mixing Kumari Swaras as Bhavna Dravya. Now, once it is nicely triturated, the भावना is been complete. उसके बाद हमारे पास एक मोल्ड है. ये मोल्ड के अंदर हम ये पोटली का जो है वो शिवलिंग के आकार के जैसे जो है ये पोटली का निर्माण करते हैं. So how do we do it? So we take this mold and we put the entire potali mixture into it, and this mold is then kept for drying. Once the potali is entirely dried, then we take out that potali for the rest of the manufacturing process. इससे क्या होता है, तो हर पोटली 1 ग्राम की बराबर वजन की जो है वो आती है. यहाँ पे भले ही हमें जो है वो थोड़ा सा ज्यादा डालना पड़ता है. द रीजन इज दैट इफ आई डोंट पुट द मिक्सचर मोर, देन वंस आई स्क्रेप द पोटली फॉर गिविंग इट अ प्रॉपर शेप, द क्वांटिटी माइट बी reduced. So each of our potalis are exactly of 1 gram of weight, and every of the potali will be having Parad, Gandhak, that is Kajali, and Swarna Bhasma put into it. Now, once these potalis are वो ड्राई करने के बाद वो अच्छी तरह से कड़क हो जाती है, उसके बाद मलमल के कपड़े के साथ इसको जो है वो लपेटा जाता है. So we take a muslin cloth and individual potali are nicely packed in that muslin cloth. and then these potalis are tied onto a, I would say, a tray, and then these potalis are dipped into gandha. Now, when this molten bonds of the potali become very, very strong. So if I can show you, this is the potali of Sri Dhootapapeshwar Limited. It comes in like this kind of a box. Every potali is there. It comes up with a QR code of standardization. And here, in this kind of a form that you get the potali, uh, when you open this potali, you will be getting such a kind of a pencil of the potali. So the upper black part is there. It is the potali. The upper black part is the potali and the lower is the pencil with which we catch. Here we give such a kind of a stone. So you don't have to tell the patient to go somewhere out or do anything. You have to take this stone, you have to put water, you have to take this potali in such a way, and you have to start rubbing the potali round direction onto this stone. And you will be getting the dose with any kind of anupan, and tell the patient to lick it for instant and very good results. Now, there are many such speculations that potali can be crushed and it can be mixed with your formulation and it can be administered to the patient. That is also one part. But by that, the potency of the potali is reduced because you're breaking the bonds of gandhak and paral. So in this way, as you can see, once the potalis are cooked, they are nicely scraped off so that whatever the material that is stuck, it is being cleaned. And then these potalis are packed individually. So in this way, we do the packing of our Potali Kalpana, which are shipped directly to your clinic or your residential address. So once again, we go on to our presentation. So here we are seeing the manufacturing of the potali, and as I have displayed to you that this is the potali. Every potali that we have is of 1 gram of weight, and certainly depending upon the patient's Agni, Bala, Prakruti, disease, Srotas, Gamitva, Dushti, all these things into picture, you can give the dose of the potali from approximately 31.25, that is 1/4 ratti, to even up to 1 or 2 ratti dose. It can be given in divided form. It can be given along with, say, Tulsi Patra Swaras or Adrak Swaras or even directly with honey. Now, if there is a patient who is not being able to consume the potali, especially because he is on ventilator support or so, in such cases, these potali kalpanas can be administered even by feeding tube or Riles tube. So these are the 6 potalis that we are currently manufacturing. And let us go into a small summary of each of these potalis. So here we have highlighted, that is Rasagarbha Pottali. So prepared from the text reference of Rasayog Sagar. Basically, this Pottali is having Rasa Sindur put into it. And if you go through the textual reference of Ayurveda Sar Sangraha, Rasa Sindur has been mentioned with maximum number of anupans. So Rasa Sindur, even though being a very strong Kupipakwa Rasayan, it has been, I would say, mentioned that Rasa Sindur helps into the Gamitva or increasing the potency of any formulation. And so if you see whether it is Vasant Kusumakar Ras, Rasaraj Ras, Bruhatva Chintamani Ras, Kumar Kalyan Ras, all these medicines have Rasa Sindur put into it. So to increase the Sukshma Srotogamitva in order to ensure Yoga Vahitva and in order to ensure even Srotoshodhan, Rasa Sindur is one of the drug of choice. Then how are we indicating Rasagarbha Potali in cases of fever? The reason is that if you look at the entire aspect of this formulation and Jwara Chikitsa, My Guruji always used to mention is that wherever you don't find answers for any of the disease, treat as per Jwara. And you will be seeing very good results of it. So whether it is any kind of immunocompromised disease where we see ANA test positive, I would say systemic lupus erythematosus, any such kind of diseases where we see such a kind of pathology where the immunity is being compromised, and jwara, whether it is santata jwara, satata jwara, bahirvegi, antarvegi, even in cases of Jirna Jwar Chikitsa also, Rasagarbha Potali can give you very good results. Complement this Rasagarbha Potali with Sanshamani Vati, Amruta Rishta, Amrutottar Kashayam, or even normal Mahasudarshan Kada also. You can see good results even in management of cancer. So these are a few conditions. There has been one reference of Hemabra Sindur use in cases of hydrocephalus. And one of my Guruji has used this Rasagarbha Potali and Hemagarbha Potali along with Abhrag Basma in cases of hydrocephalus, and the patient's intracranial pressure has started to reduce down. Now, he has seen only one or two such cases where we cannot postulate that yes, this is the drug of choice. Ultimately, the patient may have to go for a VP shunting. But certainly, till the time the operation takes place, we can use this Rasagarbha Potali for that maintenance. Similar kind of, I would say, principles can also be applied in management of raised intraocular pressure. So, in cases of glaucoma, there might be some doctors who are practicing onto ophthalmology in Ayurveda. So, this Rasagarbha Potali, wherever we see raised intraocular pressure, complement it with other Netra Dravya, whether it is Saptamrit Loha, Trifaladya Ghrita, or any such kalpas, we can see good results of using this Rasagarbha Potali. So, in cases of fever, whether it is HIV, AIDS related fever, whether it is tuberculosis related fever, because nowadays we are seeing a lot of cases of multi drug resistant tuberculosis. And Ayurveda also has promised onto the Ministry of Health that we will be contributing towards the patient care of tuberculosis. So, in such cases, Rasagarbha Potali can be one of your drug of choice. So ingredients, it is having Shodhit Parat, Shodhit Gandak, Suvarna Basma and Rasa Sindoor. In all cases of Jwara, wherever we see infective pathologies also, we can use this Rasagarbha Potali. The second Potali that we have highlighted over here is Hema Garbha Potali. Hema is Suvarna. And as you can see over here, it is being mentioned from Yoga Ratnakar Kas Rog Chikitsa Adhikar, but especially acting very good in Annavaha Srotas related disorders also. So if you are having Jirna Atisar, Jirna Pravahika, if there are cases of ulcerative colitis, in such cases also Hemagarbha Potali complemented it with Pravar Prishti, Mauktik Prishti, Kamduga Mauktik can give you very good results. This is one of the drug of choice in use of chronic heart failure disease also. So in cases of CHD, where we say the ejection fraction of the heart is reduced down, one of our own Ayurveda physicians, after seeing this webinar which we had conducted earlier, he gave a call and said that, Doctor, I am also an Ayurveda doctor. I have been using many such kalpas. I am a patient of post cabbage. My bypass has been taken place. I have a very big house, means, but I cannot walk the entire stretch of the house because I feel breathless. He was on Nagarjuna Ras and Arjuna Rishta, many such kalpas that are there. So we just said him that, sir, if you possibly can try Hemagarbha Potali along with other medicines and let us know on to the result. 1 month, the doctor himself has used this Potali Kalpana and he said, I can now walk my entire flight of stairs without even stopping. I am not worried whether my report says it is good or bad or it is remaining the same. But symptomatically, I am feeling very, very good. Such a way, the next webinar that we will be conducting, we will be having one of our eminent speaker, Dr. Sumitra Patil Madam of Belgaum, who will be speaking on use of Pottali Kalpanas in Artavah Srotas Vikar. Madam will be discussing on two very good 5 to 6 challenging cases of gynecology and obstetrics, where she has seen that even though when she was using all the regular medicines of Ayurveda, the patient was not getting very optimum results. But by just adding this Pottali Kalpanas, we can see that the patient have got good results. So I request you all to please stay onto our Vaidya Seva WhatsApp group. We will be shortly sharing you with the other details also. We will be also sharing you the presentation of how you can use this Pottali Kalpanas, with what you can use, different permutation combinations, so that it is easier for you. I am certainly not saying that this is the ultimate formulation, but what it can give you an idea. Sometimes, as per patient, you can triturate it. So, like Hemagarbha Potali, in cases of chronic heart disease, you can use it along with Arjunarishta. But similar Hemagarbha Pottali, if you're using in cases of lung fibrosis, silicosis, interstitial lung disease, you can use it along with Kanakasav, Samir Pannak or Rasasindur put into it, Chausashta Pimpali, to enhance its gamitva and bioavailability. This same Hemagarbha Pottali you can use in the management of neurological disorders also. So in cases of post paralysis, you can use Hemagarbha and Targarbha Pottali. So we will be seeing into our future slides also how we can use this Taragarbha Pottali. So in those cases, you can use it along with the Anupan of say Brahmi Grita or Sarasvata Rishta for increasing its potency and gamitva towards those specific target organs. So when we see about Hemagarbha Pottali, it is having Shodit Parat, Shodit Gandhak, Suvarna Basma and Tamra Basma put into it, and it is processed in Kumari Swaras. Where do we use this Hemagarbha Pottali? In cases of Jirna as well as Ashukari, Kas and Shwas. So if you're having a patient who has come to your OPD with tamak shwas, he is having some kind of wheezings or rhonchi that you can hear. So in such cases, you can use either Hemagarbha Pottali or Abragarbha Pottali. So take the Pottali, nicely just scrape it onto the stone, mix it with a little bit amount of Pushkar Mool Churna. If not available, add a little bit of Sitopaladi Churna, Chausashta Pimpali, nicely make it into a lick kind of a, I would say, a paste, and tell the patient to lick little by little, and maybe in the next half an hour to 1 hour, the patient's condition will stabilize. There will be a lot of patients of Pravahika or Grahani. So as we know that Suvarna Basma is a very good anxiolytic agent. So in such cases, to entirely heal the intestine from inside, as well as reduce down the anxiety, improve the absorption of the food, and improving the health of the patient, we can use this Hemagarbha Pottali along with Rasaparpati and Takra. So in such way, we can use this Hemagarbha Pottali in different diseases of Annavaha and Pranavaha Srutasvikar. This is with regards to the clinical researches that many of the, I would say, physicians all across India have done, and they have published it, and it is available onto any, I would say, online portal. The next Pottali that we are looking at is Abhragarbha Pottali. So we are using Abhrag Bhasma into it and basically promoting this Abhragarbha Pottali in management of respiratory disorders. So nowadays we see that the pollution is on high, and these kind of respiratory disorders are even seen in small children. Adults are तो different बात, बहुत सारी जगह पे हम देखते हैं कि बच्चों को भी ये बहुत ज्यादा तकलीफ होती है। छोटी छोटी सर्दी खांसी के ऊपर हम बच्चों को पीडियाट्रिशियन के पास लेके जाते हैं, तो उससे क्या होता है, एंटीबायोटिक मिसयूज हो जाता है। Nowadays, I am seeing a lot of pediatricians giving a lot of higher dose of antibiotics to even small children. By this, their gut immunity and their entire immune system becomes hampered. So this can be a very good alternative for children who fall sick every now and then. सर्दी हो, खांसी हो, जुकाम हो, बुखार हो, बच्चे को सांस लेने में तकलीफ होती है. Seasonal variations are a major factor where you can use this Abragarbha Potali. Season change, the patient develops cough, cold, and fever. And in such cases, complement this Abragarbha Potali maybe with Suvarna Vasanta Malti or just with normal Chavanprash. So, if for a kid he is not been able to lick the medicine or so, you can take this Potali Kalpana, crush it nicely, mix it with Chavanprash. We are not saying that this is something like, applying some different substance on a bread and eating it. But we are saying you that optimization of the dose and using it with a very proper ingredient. Because Chavanprash, if we look at the Falashruti in Charak Samhita, it is been mentioned. Kas Shwasa Haras Cheva Visheshenopadiyate Kshin Kshatanam Cha Anganam Cha Balanam Cha Angavardhanam. So it is a medicine that is going to do Gunavardhan and Angavardhan in a pediatric case. And in such a case, this Abragarbha Potali mixed with normal Chavanprash can give very good results because it will potentiate the effect not only of the Potali but also of that Chavanprash. So in such a way, we can use these kind of cases. This has been one of the best drug that have been used post-COVID because post-COVID lung fibrosis is being seen in many patients. And now also we are seeing those patients in our OPD. So in these cases, maybe you will be using Shwaskas Chintamani Ras, Shwas Kuthar, you may be using Kanakasav, you may be using Sitopaladi Churna, Chausashta Pimpali, Pushkar Mool Churna, but the patient keeps coming again and again. Seasonal variation, dietary variations, all these things contribute to that factor. And in such cases, to prolong the effect of our medicine, Abragarbha Potali can be your drug of choice. So in case of Kasa, Shwasa, Rajyakshma, any kind of tuberculosis, it may need not be with regards to only tuberculosis of lungs. If it is tuberculosis of bones, if it is tuberculosis of spine, if it is tuberculosis of intestine, also we can use these Potali Kalpana adjuvant with different medicine. So in cases of lung, you can use Abragarbha Potali with Suvarna Vasanta Malti. In case of spine, you can use it along with Suvarna Bhupati Ras. In case of intestinal tuberculosis, Abragarbha Potali can be used along with Suvarna Parpati. So in case of interstitial lung disease, we can use Hemagarbha Potali, Abragarbha Potali and Mauktik Pishti. Why Mauktik Pishti? It is not because it is Shita. Even though it is Sheet, it is Agni Deepan. But Mauktika, it is a very, very good Fufusabalya. So in any of your combination, wherever you are using any medicine for Fufusabala, please use Moktik Pishti into that. You will see good results and good outcome in that patient. Similarly, in lung fibrosis or bronchiectasis also, we can use Abragarbha Potali and Tamragarbha Potali. In cases of lung carcinoma, you can also use this Abragarbha Potali. So the next Potali that we are highlighting is Tridhatu Garbha Potali, which is also prepared from Rasayog Sagar. It is having Suvarna Bhasma along with Parat Gandak and Naga Vanga and Yashad Bhasma. Now, as we know, Nag Bhasma is very good for increasing the collateral circulation. So whether you want to increase the collateral circulation of your heart, whether you want to increase the collateral circulation of any kind of a non-healing ulcer, in cases of Kotha, gangrene, Nag Bhasma is your drug of choice. And for that reason, this Tridhatu Garbha Potali, we are indicating it in the management of Shukravaha Srutasvikar, in management of Prameha and Prameha Janya Upadrava. So if it is tingling, numbness that is being seen, if it is the pancreas, the insulin secretion is not proper, there is insulin resistance that is being seen because of the presence of Yashada Bhasma. See, Yashada is a very good ingredient to be used in all endocrine pathologies. So whether it is diabetes, whether it is thyroid, whether it is renal problem, in all such cases, Yashada should be added in any of your formulation. Now, when this Yashad is complemented in this form of Pottali, you can get faster and a better effective results in such cases. So in Pramehajanya Upadra, in Shukra Dushti, so whether we are seeing oligospermia, necrospermia, teratospermia, the motility of the sperms are less. In such cases, we use this Tridhatu Garbha Pottali. So can Tridhatu Garbha Pottali be used in females also? Absolutely. Because सार्वदेहिक शुक्र जो आयुर्वेद ने कहा है ये स्त्रियों में भी होता है और ये सार्वदेहिक शुक्र की कमी के वजह से हमें स्त्रियों में अनओव्यूलेटरी साइकिल्स दिखाई देते हैं. And for that reason, we can also use this Tridhatu Garbha Pottali. And I think that Vaidya Sumitra Patil madam will be explaining of how she has used this Tridhatu Garbha Pottali in management of Shukrakshayjanya Vikar. Now, this Shukrakshaya is also related to wound healing. बिकॉज जिस पेशेंट में वूंड हीलिंग बराबर हो नहीं रहा है उसमें हम सार्वदेहिक शुक्र का क्षय मान सकते हैं. And in order to boost this Shukra, we can use this Tridhatu Garbha Pottali, complemented it with Dhatu Paushtik Churna or Purna Chandrodaya Makardhwaj also. So, in cases of male erectile dysfunction or sexual arousal, we can use Tridhatu Garbha Pottali along with Gokhuru Kadha or Dhatu Paushtik Churna. Now, why in such case do we use Gokhuru Kadha? Because Gokhuru is a very good medicine to release nitrous oxide. And nitrous oxide is required for maintaining the normal erection of penis. And in, for that reason, we are emphasizing of using this Tridhatu Garbha Pottali along with Gokhuru Kadha. Instead of Kadha, you can even use Churna. So Rasayan Churna can be given, Dhatu Paushtik Churna can be given. For increasing spermatogenesis, you can use Kaucha Park and mix Tridhatu Garbha Pottali into it and tell the patient to have 1 spoon twice in a day and repeat the test after 3 months. In cases of diabetic neuropathy, we can use Tridhatu Garbha Pottali along with Chandraprabha Vati or Vishatinduko Vati also. In cases of Shweta Pradar, leukorrhea, white discharge, or patient having Rakta Pradar, menorrhagia, we can use this Tridhatu Garbha Pottali along with Pushyanuk Churna, Bolbadda Ras, Pravar Pishti, Keherva Pishti in order because we are seeing a lot of patients who undergo DUB, that is dysfunctional uterine bleeding. Patients may even develop PID, that is pelvic inflammatory diseases. In such cases, a combination of Tridhatu Garbha Pottali with Tamra Garbha Pottali and other dravyas like Devdarvyadi Kadha is there, Kuberakshavati is there. In such cases, or Bolbadda Ras, Kaherva Pishti, we can use this Tridhatu Garbha Pottali for management of Shweta Pradar or Rakta Pradar. Uh, the next Pottali that we are highlighting over here is Tara Garbha Pottali. So Tara is silver, that is Rajata. As we know in Rasaratna Samuchay, it has been mentioned that Rajata is Param Lekhan. So wherever you want to have Lekhaniya effect, you want to scrape out anything in cases of even cardiac blockages, even in cases of carotid artery stenosis, we can use this Taragarbha Pottali, complemented it with either Tamragarbha or Hemagarbha Pottali. Now, if you say that is there any kind of an evidence or a study, we certainly don't have it. But this is as far as the experience or as far as what the doctors have given us the information. So we have conducted such webinar on say Abragarbha Pottali by Dr. Hardik Chandra Kalal sir, on use of Abragarbha and Hemagarbha Pottali by Dr. Shubhamangal Acharya madam, use of Tamragarbha, Abragarbha and Hemagarbha Pottali by Dr. Ashwath Rao sir. So they have mentioned their own practical experience of how they have used this Pottali Kalpana. So, Taragarbha Potali, so wherever we are seeing the Rajat related action, so whether it is in cases of post paralysis, one of the best drug that you can use to reduce down the size of the clot and increase the blood flow to the targeted organ. So, in case of neuritis, in case of sensory neural hearing loss, in case of vision loss, in case of sciatica pain, you can use, sorry, Taragarbha Pottali. In case of repeated urinary tract infection, we can use Taragarbha Pottali along with Chandra Prabharas. In case of prostatomegaly, Bahumutrata, where we see, we can use this Taragarbha Pottali along with Chandra Prabhavati. The same combination can be used in case of cystitis, overactive bladder also. So, where other than this, we use this Taragarbha Potali. So, in case of Shukravaha Srotas Vikar also, if there is any kind of tubal blockages in female, we can use certainly this Taragarbha Potali along with Tamragarbha Potali. Sumitra madam during her presentation would be certainly sharing that she has seen some very good results of using this Taragarbha and Tamragarbha Potali formulation in management of intramural fibroids because it is of the Lekhan Karma. It is having Suvarna Basma, Parat, Gandhak, Rajat Basma and Rasa Sindoor also put into it. Similarly, the next potali that we are highlighting is Tamragarbha potali. So the main ingredient of Tamragarbha potali is Tamrabhasma that we have put into it. And wherever we see Yakrut Pliha Vikar. So as we know, Yakrut and Pliha are the Srotas related to Raktavaha Srotas Moolasthan. So, wherever we see hematological disorders, we can certainly use this Tamra Garbha Potali. Wherever we see bone marrow depression related disorder, whether it is leukocytopenia, whether it is thrombocytopenia, idiopathic thrombocytosis, such kind of cases, Taragarbha Potali also can be complemented with other kind of dravyas which will be enhancing our bone marrow function. So in cases of Yakrut Pliha Vikar, like cirrhosis of liver, bleeding disorders, we can use Tamragarbha Potali along with Kumari Asav and Arogya Vardhani Vati. In case of hemopoietic disorder, sickle cell anemia, megaloblastic anemia, pernicious anemia, all these kind of where the transferritin levels are low, in such cases also we can use Tamragarbha Potali along with Suvarnamakshik Basma and Lohasa. In case of Udara Chikitsa, so Yakrut Dalyodar, Plihodar, normal Udar kind of conditions, we use Tamragarbha Potali along with Mahavat Vidvamsa and Kshira as the Anupan. In cases of, I would say, low cardiac output, we are looking after use of Hemagarbha Potali along with Akik Pishti and Lakshmi Vilas Ras. In cases of low blood pressure, patient has come, the BP has fallen, sugar has fallen low. In such cases, we can administer Abragarbha Potali along with Suvarna Suchekhar Ras. If patients has COPD or dry cough, sleep apnea, we can use Abragarbha Potali along with Gruta. So in such ways, we are looking after the use of different Pottalis, not only in management of emergency Ayurveda, but also into our day-to-day practice. What it is, just the formula, whatever formulation that you have prepared, add some or the other Pottali to increase the Gamitva and also to increase the bioavailability of that entire formulation and to give a prolonged and a long-term better effect to your patient. So can these Pottalis be given even in Garbhavastha? Absolutely. So for that reason, we will be sharing our one webinar where Dr. Shubhamangal Acharya, Madam of Bangalore, has used this Potali Kalpana in fetal anomalies and have got very wonderful results. She has proven results, pre and post sonography studies that she has done. So right from fetal anomalies to small children who are having repeated cough, cold, fever, to even old age people. In cases of geriatric, Alzheimer's, dementia, Parkinson's, we can certainly use a combination of Hemagarbha and Taragarbha Pottali. So in such a way, we are seeing very extensive use of this Pottali Kalpana. And the best part of this is it is only available for Vaidyas through our Vaidya Seva website www.vaidyaseva.in. You have to register with just your mobile number and email ID. You will be getting an OTP verification and a verification link on your email. That's it. And your account is now active. Within 3 to 5 working days, you will be getting any of these Pottali Kalpanas directly shipped to your address. On delivery, UPI payment, GPay, credit card, debit card. So you can do prepaid orders also. You can track your orders. Please do use these Pottali Kalpana because it's a fading kind of a science. Practitioners may not have seen how a Pottali is manufactured. And maybe this was the first video that you have seen on how Pottali is to be used. But do order all our Pottali Kalpanas. If any assistance required, we are there. We will be coming up every fortnightly with some or the other different webinars to give you the entire gist on how these Pottalis can augment well with your practice. Even if you are a general practitioner, you are a plain Ayurvedic practitioner, you are a mixed kind of allopathy Ayurvedic practitioner, if you are a Panchakarma specialist, if you are a specialty practitioner, yes, even for specialty practice also you can use this Pottali Kalpana. So right from skin diseases, psychiatry, neuromuscular diseases, orthopedic, pain management, in all these sense, you can use this Pottali Kalpanas. A few Pathyapatyas that which have been mentioned that is similar to what we use for Parat, that is Kakarashtak Varga, that is anything which starts with the word K, alphabet K, you have to avoid it. So whether it is Karavellak or anything such that you have to avoid, please tell the patients on the Pathya as routine to the Rutu, the season, the Desh, Kala, whatever, wherever that you are residing, so that they get very good results with this Pottali Kalpana. So, as mentioned in Rasa Shastra, Alpa Matropa Yogitvat, Kshipram Arogya Daitvat. So, this Pottali Kalpa is such a kind of a compact way of and giving him wonderful, fast, and prolonged results. So, thank you so much all for your patient listening. These are a few of our speakers who have been onto our webinar, and we owe our entire patronage for giving us the support and promoting these Pottali Kalpas in a very, very prompt way. So, we thank all our esteemed speakers who have joined in. We certainly you also come onto this platform and share your own feedback on how you have used this Pottali Kalpas and how better results that you have received by use of this Pottali Kalpanas. So thank you so much for your patient listening. I hope that I have made my point clear with regards to this Pottali Kalpanas in a very, very, I would say, small way. It is a very vast topic. I certainly know that I cannot cover it in 40-45. I do not want to take much of your time from your daily routine of practice. So thank you so much for your patient listening. And thank you so much for your questions that are there. We have certainly recorded these questions and we will be sharing to you with regards to the answer, probable, I would say diagnosis related permutation combination. But just as I would like to say, like there is one question on how to administer the dose. So as I've said that this is the stone and this is the Pottali. So you are supposed to take small half a teaspoon, that will be around 10 drops or so of water on this, and then you are supposed to just roundly circle the Pottali onto this, And taking around 10 to 12 rounds will give you approximately 125 milligrams, that is one rati of dose onto this stone. Now, if you are saying, no, I want to give it a less dose, you can go for 5 to 6 rounds. If it's a pediatric patient, you can even give 1 or 2 rounds of the medicine and make the patient lick. You can tell the patient that take this medicine for 3 times in a day, and after 2 days revert me back. If you feel any good change, it is good. If you don't feel any change, we can increase the dose. If the patient develops giddiness, if the patient develops palpitation, sweating, blood pressure is little bit raised, then definitely the Pottali dose is a little bit higher to that patient. In such cases, need not panic. Stop the Pottali dose for few time. Take a little amount of धान्य का चूर्ण. सो हरा धनिया जो रहता है, साबुत धनिया, उसका चूर्ण लेना है. उसके अंदर आपको खड़ी शक्कर, रॉक शुगर, you have to mix it with honey and tell the patient to lick that mixture. It can act as an antidote to your Pottali Kalpana, reducing down the symptoms in that patient. So this is with regards to the dose that I would like to mention. One question is with regards to use of Pottali Kalpana in pediatric development. So we have not seen much of Pottali Kalpana use in ADHD or autism, but yes, because of the presence of Suvarna Basma, Suvarna is a very good anxiolytic. And there have been one of, I would say, many of our good physicians who instead of Pottali have used our Suvarna Prashan. So whether it is Mahaswarna Yoga or Mahaswarna Brahma Yoga, in case of ADHD, autism, in case of geriatric senile dementia, and even in cases of, I would say, Parkinson's, we can use this Suvarna Prashan to reduce down the anxiety levels and boost the normal functioning of the brain. Uh, One question was with regards to whether we can use Pottali Kalpana in Basti Chikitsa. So I have not personally given or I have not heard, but there were 1 or 2 physicians in India who have used. See, because if I have to use as an Ashukari Chikitsa method, like my Guruji used to say that if you have a patient who is having very high grade temperature, you have to do nothing, you have to give him a Shita Jala Basti. Now, in this Shita Jala Basti, maybe if you add a little bit amount of Rasagarbha Pottali, it will certainly potentiate the medicine and the effect. The patient's temperature can come down. The patient who may be going into active seizure can have a very good relief from this kind of things. So it is need to be a tried and tested method, but we request all the physicians to kindly document your results. So that, because this is one thing that as a Ayurved physician we are lacking. We don't have much of documentation. So this way we have to ensure to see to it that we can document these results and use different permutation combination. Like I have seen one of the result, and I would thank if madam is present over here, Geeta Puttur madam of Bangalore. I have personally met madam during my field visit. She has used Taragarbha Pottali in cases of diabetic retinopathy. Now, as we know, because Taragarbha is having a very good affinity and it is a very good Lekhan Dravya. So, if there is some kind of occlusion, if there is any kind of retinal blood clot over there, in such cases also where the patient's vision has gone. So, in such cases also you can use this Taragarbha Pottali. Complement it with Vasan Kusumaka because the Gamitva of that Vasan Kusumaka is toward these target organs. So, in such a way that there are a lot of questions, but we are a little bit short of time. But your questions will certainly be answered. This presentation will be shared. We will be certainly sharing with you different permutation combinations, diseases. Doses can be titrated as per the patient need. If there is Ashukari Avastha, if there is patient of Tamak Shwas which has come, You can use even 500 milligrams of Abragarbha Pottali, mix it with Pushkar Mool Churna or mix it with Sitopaladi Churna, Shwaskas Chintamani Ras, and give the patient to lick it muhur muhur. If you are going to act on samana vayu vikruti, especially in cases of pancreatitis or insulin, I would say resistant, then in such cases you can use tamragarbha potali in samudga cases also. So between two meals also you can give this potali kalpana. If you are giving it for manovaha srotas vikar or neurological disorders, you can give this at nishi, means at the night time during bedtime also. So in such a way, we can certainly, I would say, manage the dose of that patient onto the potali part. With regards to Suvarna Prashan used in cases of attention deficit hyperactive disorders or so, you can certainly use Mahaswarna Brahma Yog, which is having Brahmi and Shankapushpi Ghana put into it. We have not used extract. There is no alcoholic extract, there is no water extract. We have used ghana put into it. And for that reason, one tablet once or twice in a day, you can certainly order it through our one rati will be around 10 to 12 rounds that you can mix it onto the stone that is being given to you. And if you want to increase it, you can do the multiple of such rounds and give it to the patient. So, thank you so much for your patient listening. And we assure you that we will be coming up with more such intellectual and knowledge based webinars and answering all your questions. Till then, thank you for your patronage to Sri Dhootapapeshwar Limited.